Welcome, Dr. Krani. People in BC have told me that they can't get coverage for therapy to prevent breaking a bone, even though they're at high risk of a bone fracture. That doesn't seem right. Can you provide some details?
It's unfair that in BC, people who have been assessed at high risk of fracture do not have any publicly funded options. Currently, a person in BC has to break a bone first in order to get medication coverage. Once the fracture occurs, they go to their provider, who would then send them for x-rays and fill out a form to apply for coverage. Only then is their coverage available. Even after meeting the criteria, there is further delay in starting treatment due to the processing of paperwork and unnecessary tests, which takes up the provider's valuable time. Other provinces in Canada do not have this restriction, and the provider can prescribe a fracture prevention therapy to people who are at risk for fracture without paperwork or additional tests.
How are patients impacted by this policy?
It definitely impacts their health and wellness. Why would a patient want to have a fracture first before they can get a medication that can help prevent fractures? Many private drug plans won't even cover these medications if pharmacare doesn't. Naturally, patients are frustrated and often are left feeling helpless because they can't access these important preventive measures until they have a fracture.